In different instances, we use different techniques for the sample collection and different sites for the sample collection depending upon the suspect of the investigator that he's carrying out the investigation. So, if the investigator is thinking of any narcotic poisoning, he's going to send the samples for brain. It is very easy depending upon the organs that are more affected by the type of the poisoning suspected by the investigator. He's going to send the samples accordingly for further investigation. And he has to mention these suspects on the samples. Even a telephonic call can be given to the chemical pathologist whosoever is carrying out the examination, just as a special request to see these samples and to look for the signs of the poisoning, depending upon the cases and depending upon the investigations being carried out. So the techniques are different. In different cases, the availability of the cadaver, the time since death that has been passed, of course, in a decomposed or in a mummified body, we cannot collect samples in a way similar to we collect samples in a fresher body. So depending upon the state of the cadaver and depending upon the conditions applied, we change our techniques of the sample collection. So in this section, we'll be dealing with the techniques of the sites, for example, blood, urine, bile, CSF, that is the cerebrospinal fluid, is sometimes taken and sent to the chemical pathologist whenever we are suspecting different kind of poisons over here. Then the vitreous humor, it is again very important, and this how it is collected, what is the technique for its collection. It has got its cosmetic values, and we basically collect this from the outer canthus, and it is done very specifically not to hinder any cosmetic views of the person or the cadaver. And then the stomach contents and the intestinal contents. So the contents are sent to the chemical pathologist along with some of the portion of the stomach wall, or the intestinal wall is even sent to the chemical pathologist for detailed examination. And then the vomits and the other fluids. Of course, a vomitus is also sent because it can have the poisons in an undegraded form and is of high value. So it is sent to the chemical pathologist for further detailed examinations, and the other fluids are also sent along with that. So over here, it has never been, the site of sampling for toxicological analysis is never been obtained from the body cavities after the evisceration. So it has to be in situ. In situ administration of the site of sampling is very important. The scooping of the blood is very important. For example, if a lot of time has passed, then some massage is going to be performed even on the upper limb and even on the lower limb for the collection of the blood from the femoral artery or the femoral vein. So it is very important over here, and obtaining the intravascular blood just by massaging the upper limb or the lower limb is again a procedure which can be performed in some cadavers in which the collection of blood is being difficult at that time. So there are a lot of conventional and unconventional samples that has to be taken. So the conventional samples, even if a case is not suspected of poisoning, are the blood, the urine, the feces, and the tissue biopsy. They have to be sent to the chemical pathologist. And then on the other hand, the unconventional samples are the hair and the nail, the breath and the saliva is again very important, and the tears and the manubrium are again very important. The sweat and the mucus are sometimes sent to the chemical pathologist, but they're very unconventional methods, and in some cases they may or may not be sent to the chemical pathologist. Then the carbon monoxide estimations at the blood level are again very important, and they're very critical at this level. So the blood samples are again very critical to get and to be sent to the chemical pathologist. So over here, to dissect the femoral vein, it is very important. And to tie the vessel off proximally before drawing blood, it is again very important, and avoid drawing the blood from the groin and the abdominal region. So once the lumen is entered, 25 ml can usually be easily withdrawn. But this is, we are talking about a lot of fresh bodies, not the decomposed cadavers over here. The other veins which can be used for the blood collection are the neck veins, the jugular veins, and the subclavian veins. Now, the urine collection. So, the urine collection in a lot of the preservative, in a lot of states, the preservative is used is the boric acid, and the test tubes they are given for the urine collection. They are obtained by the catheter or the suprapubic puncture with the syringe and the long needle. The puncturing fundus is very important, and it is a very common side effect whenever we are collecting this urine samples in a lot of cases. So talking about the bile, it's basically it's useful for the analysis whenever we are suspecting the poisoning with the morphine and the chlorpromazine. So these poisons are very important whenever we are talking about the bile. The direct collection into the bottle is very important. Sometimes the preservative is added and sometimes the preservative is not added. In either cases, you have to mention on the bottle whether the preservative was added or not. Viscous to be sucked through the needle, and the cerebrospinal fluid is another sample which has to be collected and it has to be sent to the chemical pathologist, and the sample collection is again very important. It is at the level of the L4 and L5 for microbiological and the virological studies just indicating the infections or the meningitis of some sort. They can be diagnosed at this level. They can be collected by the lumbar puncture. The same levels or the same procedure is performed in the cadaver as well as in the live patient. The cisternal puncture is sometimes done if the lumbar puncture is not possible in some of the cases. It is difficult to obtain because of the lack of the intrathecal pressure, because the intrathecal pressure rises after the death, and so it is sometimes a very difficult procedure to carry out in some of the cadavers to collect this CSF or the cerebrospinal fluid. Vitreous humor is another important specimen that has to be collected, useful in the bodies with appreciable postmortem decomposition and used for estimating the time since death. So the puncture, how do we get this? We basically enter through the outer canthus with a fine gauge needle, and it has basically its cosmetic values, and that is why this outer canthus is used, and the fluid should be sucked out by the syringe. So it's basically the syringe that we are using, and the fluid is carefully sucked out by using this syringe. Now the stomach contents are also collected over here. They're collected into the wide mouth glass or the plastic pot that is almost, it has the capacity of 250 ml. So the exterior of the stomach should be washed, and it is pulled with the attached organs to the edge of the dissecting board or the sink. The greater curvature is opened and the contents flow directly into the jar. Further, the contents are scraped out and any powder, capsule, or the tablets are picked up of. Even in some cases, a small portion of the stomach is sent to the chemical pathologist just to have an overview or just to have a check. The intestinal contents are again very important. Both ends of the small gut are ligated by string sutures at duodenum and ileum. They are stripped out by cutting through the mesentery, and their intact gut can be sent to the laboratory in the large container. The mucosa needs to be examined first, and it is opened in a large clean tray, and a whole thorough examination is carried out of the mucosa and its layers, because some sort of poison can be detected in these layers and the villi of the intestine. Vomitus and other fluids have their own significances. The vomits, rarely it is collected at the autopsy, and the other fluids which are sent to the chemical pathologist are pericardial fluid, synovial fluid, pleural effusion, and ascitic fluid. So all of these are sent to the chemical pathologist, and a detailed examination is requested for any kind of poisoning. So in this section, basically, we dealt with the different kind of blood sampling and the fluid collections, that is the blood, the urine, and the CSF. How are we going to collect them and send them to the chemical pathologist? That is the end of this section. Thank you for watching sqadia.com.